We once had a young teenage boy who was admitted to the pediatric unit with new onset swelling of one of his legs. The swelling started out of nowhere. He didn't have any pain, no redness, no fever, really no other symptoms other than the swelling that had gotten progressively worse over the couple of days, so he came to the ER and ultimately was admitted to the pediatric floor. The only thing abnormal about his labs was that he had a slightly elevated white blood cell count, but everything else on his CBC and the rest of his labs and everything was normal. A DVT, or a blood clot, was ruled out, and when he came to the pediatric floor, the initial thought process was that maybe this was some sort of post-infectious swelling, as if there was some sort of cellulitis previously or skin infection previously, and there's just some residual swelling. However, this patient never had any redness, any pain, any fever, or anything that we typically see with a cellulitis or an infection of the skin other than the swelling. This patient had been seen by the attending physician, the medical student, a nurse practitioner. It was the medical student and the nurse practitioner who brought up the idea of lymphoma. This idea was sort of blown off a little bit initially, but because of the persistent swelling, orthopedics was consulted and hematology oncology was also consulted. Both of these consultants felt that this was also probably a post-infectious or inflammatory swelling, and no further workup or intervention was recommended at that time. The plan was to discharge this patient home and for them to follow up with their pediatrician. However, the medical student and the nurse practitioner were still concerned about this possible diagnosis of lymphoma, so they went back in and did a thorough lymph node exam, at which point they felt an enlarged and firm lymph node. When this was brought up to the attending physician, they still felt like this could be an infectious response, because we do get enlarged lymph nodes when we have an infection. However, we have to remember that this patient really didn't have any other signs of infection, no pain, no redness, no fever, just the swelling, which is not really typical of a cellulitis or infection of the skin. Because of their persistence, the physician ultimately agreed to have the imaging done, which unfortunately did end up showing lymphoma with metastasis. Now, this video is not to say that there are certain providers that are better than other providers. We are all human. People make mistakes. There's going to be cases where your mid-levels are going to miss something and your attending physicians are going to catch it. And there's going to be cases where your physicians may miss something that your mid-levels are going to catch. There's also going to be cases where your med students and residents find diagnoses that your physicians did not. There are two main points to this video. Number one, if you're at the hospital and you're being seen by so many different people, medical students, interns, senior residents, physicians, nurse practitioners, physician assistants, you're going to have so many people in your room, and I know it can get frustrating having us ask you all the same questions. But I promise you, this is the case where having too many cooks in the kitchen is not a bad thing. Everybody on the team serves an important role, and oftentimes it's the medical trainees and the mid-levels that actually have more time to spend with each patient, because while they may be carrying 2, 3, or 4 patients at a time, your attending physicians may be carrying 15, 20 patients at a time. So tell your story, tell it twice, tell it 3 times, however many times people come in to ask it, because it can only benefit you. My second message is to providers. Don't get stuck on a diagnosis. I know it's easy to do this, especially you get somebody who comes up from the ER with some kind of diagnosis that they tell you that they think is going on. You have consultants involved who are also telling you some sort of diagnosis, but if something doesn't feel right, if something is acting differently than what you are typically used to seeing, keep it in mind. Don't exclude your rare diagnoses. And when somebody gives you new information that you didn't have before, take it into consideration, readjust your differential diagnosis. We are all continuous learners. It is okay to change your diagnosis a day later, 2 days later, a week later. Don't miss the lymphoma. Don't ignore the important information, even when it goes against what you thought initially.